Thank you very much for joining us today on the program Healthy Living. And we've got something very important to discuss with you. A man, woman, in as much as you're finding it very difficult to conceive naturally, there are other alternatives that you can, of course, explore. And today on the program we have somebody, an expert in that field, that is going to be putting us through today. So all you need to do is call us on 052 290 573. Do not forget to call. And the other number, I don't know it offhand now, it's going to be on your screen. So what numbers are going to be on your screen? Call the doctor, especially the lady who called last week that, after some time she's been pregnant for like 3-4 times thereabouts. And then after some time the pregnancy will just disappear, just like that. Let's use the word disappear now. Okay, so we have an expert in the house who's going to be putting us through. My name is Adesu Walsawa here, and I want to introduce my guest to you. Her name is Dr. Tunika Akoyoli. She is the Clinical Director, Clinical Medical and Facility Center at Sokoro, Abuja. She's here with us in the city because she's heard of this program and decided that she has to make a contribution to Edo people. She is from Edo. And so she watched the program, she saw it, she heard about it, and said, no, let me go do this for my people. And that's why she's here in Edo State. It's nice to have you, Doctor, on this program.
Thank you.
And thank you for wanting to be part of your people.
Yes, it's part of having help on humanity.
Okay.
And to serve African women mostly, that we care so much about having children.
Okay.
Yes.
All right, people, it's 052-290-571. Please call and ask questions. Today we're going to be looking at alternative methods of conception, alternative method of getting pregnant. It's easy for most people. You find a partner, you have sex, the next thing is you're pregnant. Whether you want it or you don't want it, it will just come like that. But for some others, it's not so. They find a partner, they have sex like God knows how many times, and it will not happen. 1, 2, 3, 4, 5 years, 6, 7, 8, 9, 10 in marriage, and they are still where they are, not their fault. They might go to the hospital, do checks, and doctors will confirm them fit and proper. And for the man too, fit and proper. But you don't know where these problems are coming from. So, thanks to science, thanks to medicine, there is alternative, not just one, not two, not three. Several alternatives for you to get pregnant. And so, Dr. Tunika, do you mind if I address Dr. Tunika?
Yes.
Okay. So we're going to be addressing her. Tunika, she's going to tell us a lot. So Doctor, when we're looking at alternative method of getting pregnant, exactly what are we looking at?
Okay. We tend to introduce what we call in vitro fertilization.
Okay.
When it comes to achieving pregnancy outside the body, especially when a couple has been together for having regular sexual intercourse for more than 12 months, and they are still not able to achieve pregnancy or being conceived. Then they come all the way for investigation. And if we find out that maybe it's the woman or the man that has a fault, then it should give us a definite idea on what actually step to take.
Before going into in vitro fertilization, if it is that the man's semen count is good, we just have to stimulate the woman a little bit with injectables, because we know that every month a woman releases an egg, or even two. But in IVF, when a woman is being stimulated, we use stimulator or injected with fertility medication, she produces a lot of eggs. Good. So the first step is, like we used to say, if a man's count is really good. And when he produces, we separate the seminal fluid from the semen, which contains the sperm cells. And we introduce it straight into the woman at a particular time, let's say 14th day of being stimulated, and we are expecting the woman to ovulate. And the sperm cells stay inside the body between 4 to 5 days. And if we have the eggs being ovulated, it flows through the tubes and goes through and meets with the sperm. By God's grace, and they achieve pregnancy, that is good. Well, if we try that for about 3 months and it's still not successful, we have to go over to the higher technology, which we call in vitro fertilization, whereby the woman being stimulated, we are collecting the eggs from her. Yes, we collect these eggs from her using very high tech.
Okay.
Yes, and it's being used with inverted microscope because it's been magnified like times 400 magnification because the eggs are very small.
Okay.
Yeah, when we do this, if it's a good count, like I was to say, that's a man's sperm that's good, we introduce the sperm cells into a special dish that contains a fluid that can keep the babies, the embryos to a particular date before they are being transferred back into the woman.
Is it by operation? How do you transfer?
No, we go through the vagina.
Oh, okay.
Yes, because when we're stimulating, we have a scanning machine that has abdominal scan and a probe scan that looks so much like a man's reproductive system. Okay. Yeah, we use it to track a woman's sexual stimulation, if she's actually responding to the medications or not. Because doing this, we have to be sure that the woman has quantity and quality eggs. Because if she has poor egg quality, that's also going to be a challenge. Okay. But if the woman is still very young and the man's sperm count is good, we believe that pregnancy will be achieved. So when we go through into the vagina, using the probe, there's a scanning section that will help us out to retrieve the eggs. It goes through a pipe and we set it in a particular dish. This dish contains a fluid, a medium, that controls fructose to help the babies to develop. We wash the sperm cells away from the seminal fluid and put it back into that particular dish. And we work for 2 days, the 3rd day, but mostly we transfer on the 5th day, which is the last stage of development of an embryo into the woman's uterus. And after this, we wait for 2 weeks, and the woman is pregnant. Congratulations to her.
Wow, everything sounds so easy and so simple.
Yes.
I know you have questions to ask, especially those who have been waiting for conception, who have been waiting to get pregnant. It's your chance. Ask the doctor a question so that you will know what to do. There are methods to use. All right, doctor, while you were explaining, you talk about age. What has age got to do with conception?
Yes, we'll look at it that when we go into puberty, the woman starts to develop breast and system about men and women. We tend to look at before now that a woman is very fertile from a very age, maybe let's say from 18 to 35 to 40.
Okay.
Yes, before we were in school, we would say, okay, from 40 years, some women are going into menopause. Well, lately, in all these societies we go to, European society, and American society, and even African here, we have realized that women tend to also run into premature ovarian failure. Yes, a lot of it. And you're looking at a woman, she's young, and she's beautiful, but she's not producing good eggs. She's not ovulating.
What could be the cause of that?
Yeah, she may have amenorrhea and ovulation. Maybe it's genetical. Yes, it may be genetical. So what do we do? Sometimes we place these women on medications to help them actually have good eggs. Yes, and this gives us idea when we take their blood sample for hormonal profile. It tends to help us what number of follicles and luteinizing hormone that have been present in the woman.
So age is good.
Yes, age is a good factor.
Is 45 and above, does she have any hope of getting pregnant?
Yes, a woman that's above 40, and if her hormonal profile still says that she has a very elevated FSH and LH, we will be able, as long as that woman has a uterus, as long as she has a uterus, I tell you, you can have a baby. Even though she's like 50 years, she's 58 years, as long as she has a uterus, she will be pregnant.
Even in the absence of fallopian tubes?
Yes,
there
yes,
are some women who have lost their fallopian tubes, maybe to ectopic pregnancy, or maybe one disease or the other.
Yes, you see, that's why IVF is here, because we bypass all that. When a woman, she have infection and she didn't treat it when she was so young, and the tubes are also blocked, she have like pelvic infection, we pass through all this and retrieve these eggs out, and we do the fertilization outside the body. Okay, and like you rightly said about women from 40 to 50, most of them don't see their menses anymore. But with their medications, we will just give to them for like about 21 days or 28 days. And even if it's spotting, they do, and with scan they are good, then we begin to build the endometrial lining. Then, talking about the eggs we may retrieve from women that are 40 to 50. Yes, it is compromised because we are about to avoid having children with any chromosome abnormalities.
Okay.
Yes, because it's very high when you have your hormonal profiles that are not balanced. So what we do, we match up with what we call donation, egg donation, just the way that people talk about blood donation.
Okay.
Yes.
So
And
how does this egg donation work?
yeah, this egg donation, we actually take it from ladies that are educated between 18 years to 26 years old.
Do you pay for this?
Yes, we compensate them because you can't really pay anybody. We are custodians of what God has given to us. And I look at it that these girls, when we go to schools, we see them instead of being prostituting, okay, or making money means of not going through the right way. We discuss to them, and because they have a lot sum of money.
Is it legal to donate eggs?
Well, for now, they are still preparing that legal aspect when it comes to egg donation, because it's all over the world. It's in Europe, it's in America, but just partly in Asia, it's not allowed. But in Africa here, a lot of people achieve a lot of pregnancies using egg donations, yes, because these ladies, they are young. We actually also...
And the eggs are good?
The eggs are good, yes, because they have quantity and quality eggs. Okay. Yeah, by the time we remove it from them...
But is it, how comfortable do you think a woman will be to get donated eggs?
Yes, it's a question that they usually ask, like, I'm not a genetic provider. Is it that when you take the eggs from the lady, what's going to happen to me? So I tell you, fine, madam. It's just like you having been needing blood, okay, even when you're pregnant. And you say, no, you know you won't survive, because we know that your blood level is low. So aspects in egg donation, even sperm donation, is still the same. It's just that you have to explain to every young girl that this also will not jeopardize their future. Because as you're young, you're donating your eggs, you must not donate more than 4 to 5 times in your lifetime. And you have to be very careful, and then in terms of going round if you're doing donations.
All right, the number is 052-290573. Give the doctor a call. Ask any question that have to do with conceiving a child other than the normal way. Science has made it so possible that be you 45, 50, yes, and you desire a child, you can get one if you are interested, okay? And for the men too, you have problem with your sperm count, and you need to see the doctor, or you don't have sperm count at all, you need to see a doctor, you need to talk. There is no point in being shy about it, all right? Nobody's going to see your face, and you don't really have to call your name if you don't want to call your name, because you don't want people to know. Yes, we know the society that we live in. A lot of people know how to laugh at somebody without really taking time to find out the problem that that person is going through, okay? So don't give a thought about what people will say. Just give about a thought of, you know, being happy of carrying your own baby.
Yes.
We've talked about donor eggs, we talk about in vitro fertilization. What about the one called embryo adoption? How is this one done?
Yes, the right word would be embryo donation. Okay. Now, in this aspect, this is an unexplained infertility between a man and a woman. He is old, and the woman also is also old. Let's say she's advanced in that age, and the man's count is good, or uterus is good. So what we do is that we have to collect the eggs from a donor, and also look for somebody that have the same characteristics to that of the man, who have in the same blood group and genotype. Yes, and we think about other serology tests to be sure that they're free from HIV, hepatitis B and C. It's not like those people don't get pregnant, they also do get pregnant. But we take the sperm and the egg, we fuse them together, create a baby, and transfer it back into the woman that isn't prepared to carry the babies, yes. So that means there is no genetic you are providing from the male and the female aspect, because it's been done actually outside where 2 of them are. So this woman decided to do it, and it has to be in agreement, because you need to have a consent form filled out that you understand exactly what you want to do, that yes, your wife's uterus is fine, and also your sperm count is okay, but just that you fail to have a child. Then we'll look for someone that has a good sperm, which is sperm donation. and egg donation. We fuse these two together, do the same in vitro fertilization, or we do the highest form of IVF, which call it intracytoplasmic sperm injection.
Go over that again.
Okay, we call it ICSI,
Okay, ICSI.
Yes, ICSI, intracytoplasmic sperm injection.
Okay.
This helps for men that has very low sperm count, less than up to 20 million, even if it's 10 million cells, or like 5 million or 1 million cells. We are able to take single sperm and inject it. Inject a single sperm into an egg, and they develop to embryos up to day 5, then before we do the transfer.
Okay, all right, people, it's 052-290573. Give the doctor a call, ask a question, ask everything that you need to ask. Let's quickly take a short break here. When we come back, we will continue with the program, Healthy Living, with the topic, alternative methods of conception or getting pregnant, as the case may be. We'll do that break now, PD.
Igbenedion University Teaching Hospital, School of Nursing, Okada. Applications are invited from suitably qualified candidates for admission into the above school for 3-year course in general nursing, leading to the award of Registered Nurse Certificate, RN. Entry qualifications: candidates must not be less than 18 years and must possess SSCE or NECO 5 credits in English language, biology, physics, chemistry, and mathematics. Application form stating age, state of origin, local government area, schools attended, and qualification obtained should be addressed to the principal, School of Nursing, Igbenedion University Teaching Hospital, Okada. Forms are obtainable from Igbenedion University Liaison Office, Airport Road, opposite Glass House, on the payment of 10,000 Naira bank draft only in favor of Igbenedion University Teaching Hospital, Okada. Completed forms should be submitted on or before 7 September 2018. Examination date, Saturday 15 September 2018. Time, 9 a.m. prompt. Venue, Igbenedion Education Center, 218-220, Murtala Mohammed Way, Benin City, Edo State.
Thank you very much for joining us on the program, Healthy Living. What is the kidney?
The kidney is an excretory organ in the body, which is for metabolism.
Tuberculosis affects many organs in the body, but the common ones it usually affects is the lungs.
Epilepsy is a neurological problem.
Okay.
It is an injury in the brain which causes someone to begin to convulse, to go into fits.
It is curable, but the cure is a long-term thing.
If you eat well and avoid those risk factors that will make your immunity to be down, then the risk of contracting tuberculosis will be reduced.
If you're healthy, then you're wealthy. All right, thank you very much for staying with us on the program, Healthy Living on ITV.
Yeah.
052-290573 is the number to call. I'm urging you to call so that you don't wait till after the program before you start calling the doctor. Call now. Do yourself a favor. It's the best that you can do for yourself, because I know how it is. Yes, the phone numbers are right there on the screen. 070-8365-1320 and 052-290573. All right, Doc, we're looking at alternative methods, other forms of getting pregnant apart from sexual intercourse with your spouse. That's what we are looking at now.
Yes.
All right, so we want to look at the safety of egg donor.
Okay.
How safe is it? Is it not possible for the person who donated eggs or embryo to come back tomorrow to say that, no, this is it, and I will not leave this, you know, this child is mine, or something, something, something. Okay. What's the safety in all of this?
All right, good. When we talk about egg donation, like I still explained, we use ladies that are very young, between 18 to 27, 28 years old. And when we are filled and we know that they're qualified, they fill a consent form to actually know that they're not baby selling any of their eggs. That they're just trying to help, voluntarily, to help a couple that are not being able to achieve a pregnancy. Yes. So the filled form, like I was just saying, we do anonymous egg donation.
Okay.
Yes. Why do we do this? Because we know that in this part of Africa, for now, I will say for now that they may just spring up one day and tell you, oh,
to blackmail.
Oh, madam, I think I saw you sometime in this particular hospital. I was the one that donated X to you. And the next thing, you are like, oh my God, why did I have to do this? Okay. So, in both aspects of the couple and the
they don't have to know each other.
They don't know each other. So we are actually the people in charge to actually do this selection for you. If the man is so tall, he's dark, and his blood group and genotype actually matches with that of someone that looks like the wife, we go ahead and do that. Or if the wife is like, she's very fair, and the donor we are getting has the same blood group and genotype of her husband, we'll go ahead and do that. Yes. And the woman becomes the biological and the reigning mother, but the father becomes the genetic, biological, and the reigning father.
Oh,
yeah, the difference is
awesome.
that the woman has to carry the child.
Yeah.
Yes, and again, the other option is like, some people want to, okay, they want their younger sisters to come in. Okay. We try as much as possible to decline on that to patients that is not safe, because later in life, you may be liable forever to your sister, your cousin, or someone. So the best thing is, why don't you just go for an animal's egg donation and just believe in our own form of choosing, yes, someone that actually is anonymous to you. Okay. You know, we actually go for girls that are educated, yes, and sometimes questions come in, I hope they don't have this kind of illness in the family. All these medical histories are taken.
Let's quickly take this call and we'll come back to you. All right, hello, Kala, good afternoon.
Good afternoon, madam.
Yes. What's your name? Where are you calling from?
My name is Sonny.
All right, Sonny, can you turn down the audio level on your TV set?
Thank you very much. I'm calling you from Airport Road.
Okay, please go ahead with your question, Sonny.
Yeah, thank you for bringing this, doctor.
Okay.
I listen to your health matter, especially on radio.
Thank you too.
But I have never made contribution. But this matter now, this one, this alternative
method of getting pregnant.
Method of, yeah. I have a brother. He did that before in.
No, go over that again. You have a brother.
My brother.
Your brother, okay.
Yeah, he's in New York.
Okay.
He went through that process of IVF, but it wasn't successful. Although I told him that I heard about that in Nigeria before. I don't know if there's anything you can say about that. Maybe you can give alternative information I can get.
I'm finding it very difficult to hear you.
You said?
I'm finding it very difficult to hear you.
I said, after the program, I will be glad if you can give me alternative information where I can actually reach out to you.
Oh, sure. We will.
The reason is because I told him about it, because he did one in New York. It wasn't successful.
Okay,
so
no problem. I can just give you that number now.
So he can get across to you or the doctor.
Okay, I can just give you that number. Now, you have a pen with you?
I do not.
Okay, I'll give you the number later then. Just keep listening to the program, you hear me? All right. Okay, you know what you do? Call this number on air after the program. I'll be there to give you the number. You're welcome. All right, people, we're still moving on. 0522900573. Just call us. You know, a lot of people do complain about this IVF that is not really 100%.
Yes.
Some would tell you, oh, they have tried it like 4 times,
yes,
5 times, and it didn't work, so they just resign themselves to fate. What are you going to tell them today? Okay.
I will say again that IVF/ICSI is not 100%. But as far as the technology has gone, we are getting up to 60 to 70% success rates when it comes to the case. So when we tend to look at it in African section, or partly, let me say, Nigeria, or where I practiced from before I opened, we try as much as up to 13 times. At least before a woman does a first, second, third, fourth attempt, you are not going to pass through the same procedure. Okay. We are going to be changing medications along to be sure and know exactly why you're not getting pregnant.
So you should not be discouraged.
No, you shouldn't be discouraged at all. You shouldn't.
Okay, hello caller, good afternoon. Okay, what's your name? Where are you calling from? All right, Samson, how you doing? Okay. Go ahead with your question, Samson.
Is it advisable for us to get married?
What's your question?
I said I am AS, genotype AS.
Okay.
And my girlfriend is genotype AS.
Okay.
Is it possible for both of us to get married?
Okay, he's genotype AS.
Yes.
His fiance's
AS also.
cell.
Yes, that's true. It's okay. Is it true?
Yeah.
Okay, fine.
True.
Yes, there's something we call pre-genetic diagnosis.
Okay.
This time around, she undergoes the same procedure of undergoing IVF. That's we stimulate to the particular day that we have to retrieve the eggs out of her from the 14th day of the particular cycle. And on the day 3 of the baby is out of the woman, they are in the incubator, we tend to remove every cell, like a cell, out of the generated embryo.
Okay.
Or we take it up to day 5, which is the last development of an embryo.
Okay.
We go straight to hatching, we call it laser hatching.
Okay.
We go straight to removing the zona pellucida, which is, we call the eggshell.
Okay.
We remove some cells and do a tubing, and we do analysis on it. So actually check if this particular embryo is carrying an SS. Okay. We separate it from the ones that are AA, AS, SS. Okay. And when this is done, the woman is prepared and called for the next cycle of inner transfer straight into her womb to avoid carrying a baby that is a sickle cell.
Oh, so it's very possible.
It's very, very possible, and it's also expensive.
Ah, I like that part. It's possible and it's expensive.
It's expensive.
So if you like a girlfriend that much and you want to marry her, your AS is AS, then you should be ready to spend money to make sure that you do not have kids that are SS. That's what the doctor have just said. All right, we have another caller. Hello, caller. All right, while we're waiting for that call, let's look at the issue of, okay, there's a caller. Hello, caller, good afternoon. Hello, good afternoon. Yeah, we can hear you. What's your name again? Can you tell us your name again?
Hello.
Hello, what's your name?
Hello.
Hello, I can hear you. What is your name?
Precious.
Your name is what?
Precious.
Oh, Precious, how are you today? Precious, ask your question.
Okay. When a woman's tummy is hot, can she get pregnant?
When a woman's tummy is bulged?
Yes.
If the woman has big tummy, if she can get pregnant, is that your question?
Hello?
Is that your question? If the woman has big tummy?
Yes, when a woman's tummy is hot.
Okay, have you tried getting pregnant before without success?
How possible is it for her to get pregnant?
Have you tried getting pregnant before without success? Have you tried getting pregnant before, Precious? All right, we lost that call there. Precious wants to know if it's possible to get pregnant when a woman has big tummy.
That's funny. Well, we see that sometimes we feel someone that is on the slim side, they get it so easily than the people that are also on the big side. We also look at it that obesity sometimes can cause you having infertility, especially also in men and in women.
Wow.
Yes. Whether her stomach is bulgy, is it that she has fibroids or it's just fats? And if we're able to assess her ovaries and her uterus, it's okay, then we just go ahead. Because you see even women that are even advanced or not or so young, they get pregnant naturally.
Well, what's the possibility that once the woman is obese, she can actually keep the pregnancy to term?
Yeah, you see, she has to be under monitoring with us, especially if a successful program she achieved through doing IVF. She has to be under control. Because sometimes they just tend to develop hypertension, and some of them also develop gestational diabetes.
Okay.
Yes, we keep them on a low profile and also try to tell them to go on very low carbs. Yes, because it needs to help us. Because
be strictly monitored.
Yes, really strictly monitored, especially if she's been trying to get pregnant on her own naturally. Yes.
All right, a question that came in while we're talking is that the woman says she doesn't have a womb.
Yes.
As a result of a procedure she went to, that she knows she doesn't have a womb anymore. And she doesn't even, if she has ovaries still, she's not really sure, but she just knows that as a result of bad abortion, the womb went away with it.
Okay.
So is it possible for her to carry her own baby?
Yes, this is possible. What we do, we call surrogacy.
Okay.
Yes, full surrogacy or partly surrogacy. The first one is gestational surrogacy, whereby if she's not too sure that
she lost her womb. Let's just know that she lost her womb.
Our ovaries, if her ovaries are still there, fine, and she's young, she doesn't have a uterus. We do the same stimulation and also retrieve the eggs out.
Okay.
Fertilize this outside the body with husband sperm cells.
Okay.
And we prepare a surrogate mother. Surrogate mothers to us, or to me, is to have single parents. I've lived here in Benin for a very long time, and I see the way women are very active. And I tend to look at it that doing surrogacy gives you a lot of money.
Okay.
Yes, because you're helping to achieve somebody's dream in trying to hold
that
their babies.
Take eggs from the woman who cannot carry pregnancy.
Yes, or who she doesn't have a uterus. Wow. And we do this to widows, that tends to see that they're still at that age of reproductive line.
Okay.
We stimulate the endometrial lining in the uterus and transfer these babies that we also make back into the surrogate mother. Wow. We use about 2 to 3 surrogates to actually achieve the pregnancy. And we keep them to ourselves. They don't know you. You don't know them. The only thing, you sign your consent form. She signs a consent form. She knows that this baby is not hers, and she's signing not under duress, that she's just trying to help the couple. Yes, to achieve the dream, because it's not uterus in the woman or whoever. And this helps them till the 9th month, and when delivery is about to take place, or as the process of the surrogate pregnancy goes on, we tend to tell the clients, this is how progressive we are. She's actually 3 months now, she's 8 months, and we're preparing for pregnancy. Whether you're in Nigeria, you're outside Nigeria, it's possible. Then we take the delivery, separate the surrogate from the babies right away, and call in the women that are in charge, and deliver the babies back to who genetically has it.
Okay, so I'll come back and ask you this question. Hello, caller, good afternoon. Good afternoon. Hello, I can hear you. What's your name?
Okay, my name is
Oyeneko, ask your question. Who they talk, who they hear, or something like that. Okay, go ahead.
If a woman, can you get pregnant?
If a woman, if a woman, womanize. Yeah, I don't get it.
Womanize.
If a woman womanize, if she can get pregnant. We'll think about that, your question, and give you an answer later. All right, let's get somebody to call us again, because I don't understand the woman womanizing and getting pregnant. Hello, caller, good afternoon. Hello? Okay, while we're waiting for that call. Hello, good afternoon. How are you?
I'm fine.
Okay, what's your name?
Hello?
Hello, what's your name?
Okay, I'm Philomena.
Okay, Philomena, ask your question, please.
Okay, ma. Mine is really I don't know, it's really a problem. I really want to know, because I've given birth to a child. So the child is almost 3 years plus now. I've not been able to get pregnant again. Okay. Although I was into family planning, and I stopped it about 1 year and 5 months ago.
Okay.
But I've still not been able to get pregnant.
Okay. All right. The doctor is here to answer your question.
Hello?
Okay,
all right, Philomena?
Philomena.
Okay, Madam Philomena said that you have a child 3 years ago, and since then she has not
been able to get pregnant.
Yes,
again,
so
she was on family planning, which is stopped like 1 year plus.
Okay, good. What she needs to do is just to do some investigations, and I don't know how old she is, and we have to be sure that the tubes are okay. And hormonal profiles are also okay. That's when we talk about that, we talk about the follicle stimulating hormone, the hormone that's responsible for production of eggs.
Yeah.
So if it is that it's good, and just that maybe her tubes are blocked, then she will require doing an IVF. Yes, we have to now stimulate her, get the eggs outside, because it's all forms of assisted conception. So when we take this outside, then we go back 5 days after collecting it back into the uterus. And like I was just saying, she's pregnant 14 days later, then that is good.
So at what point do you tie up the neck of the womb? You know, if a woman is having problem. I know that there is this thing called
a cervical circulation.
Yes, okay.
Good.
So at what point do you do that for the woman?
For us, when we see that a woman gets pregnant through IVF, immediately she's pregnant, to me and with my faith, I believe that you're also the same with a woman that got pregnant naturally.
Okay.
Yes. We take precautions. We try to support the pregnancy to 12, 13 weeks of pregnancy. And we check if the woman's uterus, her cervix is short to long. And if she doesn't require cervical cyclage, we wouldn't do it. But if she does require it, then we have to go ahead. But there are also some women with a lot of fibroids in their uterus. And maybe they are carrying multiple pregnancy, because in IVF you tend to have more than 2, 3, 4 babies, yes. And some couple were like, no, we don't want more than 3, we don't want more than 2 or 5. We do what we call fetal reduction. One, the number of babies that replace itself after in vitro fertilization, we actually do what we call fetal reduction to 2 to 3, or personally the woman's health is not too good. Okay. Especially if she's maybe diabetic, she has pelvic infection, she has some surgery, she can stand properly.
So one is diabetic and go through this process?
Of course, very well.
Wow.
Yeah, because your endocrinologist won't be in charge, even if you are HIV. Positive, wow. Yeah, you are ready to do an IVF. We are coming out to let you know that pregnancy is achievable. And it's also a crown on honor to you that you hold your babies also, whether you have a uterus or not. Now, there was a question we were talking about before this came in about surrogacy. Yeah. Yeah. Some patients, they're like, oh, my family, they wouldn't want me to, my husband is in, in the same line with me to do the surrogacy program. And my family would not. That's okay, that's not a problem. There's something we call baby bump. We just make sure at the 4th, 5th, 6th weeks, months of pregnancy, she wears this baby bump. Okay. And nobody knows that she's pregnant. Okay. And before you know it, another 3 months, we've heard that she's delivered. Yes, just to protect the woman's interest. But there are some people that don't care and say, no, I don't care, I've tried. Everybody knows I've tried. So why don't you just go into surrogacy? And I don't want to know whether somebody thinks I'm the one that had a baby.
You know, for most Nigerians, this is new. This is alien. Yes. This is not what should be practiced. How do we get those people to key into the fact that every woman deserves to hold her own baby?
Yes. This one means, like we're saying, and like I say, just ignorance that have made a lot of people not to know about this. But in this age that we are, please, they need to read so much and have a vast knowledge about IVF. Okay. No woman should die having a child when you don't know anything about. You can do alternative when it comes to assisted conception.
Hello, good afternoon.
Good morning. Good afternoon.
Good afternoon. What's your name? Ask your question.
Isaac.
Okay.
I'm from Okada.
Your question, please.
Yeah, I want to ask that when woman get maybe pillow like 3 months, after month you go see what if he cause those kind of problem.
You say one woman see her period 3 months?
He missed 3 months, you don't see him again. When you go enter 4th month before you go see him.
Okay, irregular menstruation. The woman says that 3 months, then after that you will not see it, then later see it again. Okay, irregular period, that's the man's.
Yes, that's like an amenorrhea. That's a woman that doesn't have a regular cycle. She also tends not to ovulate every month also. Right now, she has to do IVF. Sometimes she may just ovulate and she wouldn't know, and she gets pregnant also, she wouldn't know. Yes, and there's something we call polycystic ovarian syndrome. These are a woman having more than 8 to 12 follicles on her ovaries. Wow. This tends, yes, in some women, this tends to make them not to have regular cycle, and ovulation is there. Sometimes she can bleed like 3 months or 6 months, and you're tired, you're like, why is it that mine is different? But I tell you the truth, that women that are polycystic also have a very high chance of carrying a pregnancy, because once we retrieve and remove those eggs, we help her to support the pregnancy, because she's actually a little bit different from every other woman. And with this knowledge, I would like you to know also, I am part of that. Yes, I am part of that. I used to have very irregular menses. Really? But right now I have kids.
Wow.
Yes, I have kids because it's not, you will have it when we do these IVF. Okay, you will bleed. Yes,
I'm glad to know you're a living testimony.
Yes, I'm a living testimony of a polycystic.
Easier for people to understand.
Yes, I'm a living testimony of someone that is polycystic or having polycystic ovary. Yes, we don't ovulate. We have amenorrhea for a long time, and sometimes we just bleed for like a year, sometimes 6. So you don't even know what to do. But once we stimulate most patients that are having polycystic ovaries like me, your egg seems to be filled up everywhere. And we have to take care of you to make sure you're on bed rest and you're having what we call a luteal support to support the pregnancy up to 8 months or the 9th month.
Wow.
Yes.
I'm happy you're speaking as a scientist, a doctor, and of
yes,
somebody who have gone through that.
Oh, yes. Oh,
hello,
yes.
Good afternoon.
Hello, good afternoon.
Welcome to the program. What's your name, please?
I'm calling from Benin.
Okay.
Yeah, I want to ask a question.
Please go ahead.
Hello?
Hello, go ahead with your question.
So, if a woman is pregnant, how am I going to be close to her?
Okay, can you just repeat that, please, so that I can hear you properly?
Yes, sir?
Can you speak up a bit so that I can hear you properly? I'm finding it difficult to hear you.
My what?
Can you speak up? Speak up a bit. Talk louder, please. Hello? Please talk louder so that I can hear you.
Who missed that?
All right, when you call, please speak up.
Hello?
Hello, good afternoon.
Good afternoon.
What's your name? Where are you calling from? Okay, ask your question. Okay, your question, please.
Hello?
Hello, I can hear you. Ask the question.
That said that if woman womanize, you carry belly.
I don't understand what you mean by woman womanizing to carry belly.
Is it trying to talk about lesbianism?
Are you talking about lesbianism or what?
Because it's men I would think about it.
Okay, I think that's what he's trying to say. If a woman meets a woman, all that. Well, you will have to call us again because this your question is one kind. All right, so we have another caller, please. Hello, good afternoon.
Hello.
Yeah, good afternoon.
Good afternoon. My name is Peter.
Okay, Peter.
I'm fine.
Ask your question, please.
I said, I'm fine. Please, I have a problem with my girl.
Okay.
It's more than 6 or 7 years that I'm getting pregnant, but I don't know what is going on.
6 or 7 years, she has not been able to get pregnant.
So I don't know what to do.
Okay, have you done any investigation? Have you gone to the hospital?
Yes, I've gone to the hospital.
It's okay, okay. Doctor will take it from there.
You said what?
The doctor will talk to you now.
He said he has gone through.
He said he has done some investigation in the hospital.
Okay.
I don't know what kind of investigation he did.
If your wife is about 6 to 7 years not still pregnant and you've done some investigations, we need to know the results of what came out from the investigations to date. Because we have to be sure that her tubes are patent and also she doesn't have like any pelvic infection. Then the same thing again, apart from her doing her own investigation, has he done his? Is his own count okay? Because those investigations, like you say, he has done, and if they certify that both of them are okay, we can say it's unexplained. That means, okay, we have to take the man's sperm, do the same first test with, like I said, the IUI, intrauterine insemination. Okay. So yes, we bypass, we just go through the tubes, introduce the sperm, and wait for another 2 weeks to see if it's positive or not. But if the woman's tube, it's blocked, then we need to go do an IVF outside the
you know, in our society, it's quick for a woman to be sent out of marriage.
Yes.
Oh, you don't have kids, please leave our son, leave our family. An investigation on the man is usually not done.
Yes. I think
it's always the woman's problem.
Yes,
so I don't know if men too don't have problems.
No, I think this mentality has to be wiped out, and in this case, that all of us educated, because sometimes it's not the woman's fault, and we've seen in this age that 40% of infertility is being caused by the man or the woman. When we see couples, they're like, I gave birth to someone 10 years ago. You cannot tell me, I have a problem. No, I don't know why the African men, they don't like doing investigations. But mostly, sometimes you go in there, you will see that their sperm count is down. Okay. You take alcohol, you womanize, you smoke, you wear wear somewhere that is so hot to your scrotum and destroy some of your cells, or when you were young, you fell, something happened to your scrotum, or you had mobs, or just some abnormalities inside of you. Okay. But in Africa, we just tend to look much more into the woman. This is very unfair. With my 14 years of practice, I would say that both couples must be investigated before it has been qualified that the woman is the one that is in charge.
Okay.
Yes.
So let's quickly take this corner. Hello. How are you, lady? Hello.
Please, how can I get the number to reach her later?
Okay, just keep watching the program. The number will be rolled out in a moment.
They're just taking our light now.
They are just taking your light.
Yes.
Okay, 080.
Okay.
351.
That's my
Again,
number.
please.
Okay, my number.
87406.
Please call
Okay,
again.
080. 351. 87406.
Okay, thank you.
All right, so we're still here. We're talking with Dr. Tonika Akunyuli. She is the clinical director, Tony Cleo Medical and Fertility Center at Sokoro, Abuja, who has come to Benin to be part of the program Healthy Living. So let's do this call now because I think time is almost up. Hello, caller, good afternoon. Hello? Yeah, good afternoon. Hello, good afternoon. Yeah, what's your name? Where are you calling from? Okay, quickly ask a question because time is not our friend.
Oh, no.
Yes, it's very expensive.
Yes.
So how will somebody do it 1, 2, 3, 4, 5? So how will that person pay for that kind of procedure?
Okay. She said IVF is very expensive. Why should somebody do it more than once to get the desired results?
Well, like I was just saying, we came in as assisted conception outside the body. We just talked about someone after 6 to 7 years of trying and even doing some investigations. Yes, IVF is expensive because of the medications that have been used. Most of these drugs that we get are not from Nigeria. We get them outside the country. And these are also incorporated into your bill. But I tell you that from the beginning we started here in Nigeria, the prices have been a bit going down. And I want to introduce to you that we do promos, then trying to use like 900,000. Yeah, there's a promo going on from...
Is there a program for like
installment payments? Yes, I do that a lot.
Pay in installment?
Yes.
Okay, that's interesting. I think
yes,
it will give a lot of Nigerians
they hope.
All right, people, time is not our friend again. We've been talking about alternative methods of getting pregnant. Be you 50, be you 45,
be you 58.
58, you can still get pregnant, okay? And if you're willing to do it, then go ahead and be happy with yourself. And men should also learn.
Yes,
to also learn to do investigation because the doctor just confirmed that it is not usually the woman's problem.
No.
40% man, 40% woman, 20% nature. Okay, so that's how it works. And if your wife is in this condition, try your best possible to be of an assistance to her instead of sending her away from the home. So give Dr. Tonika a call on this number 080-3518-7406. My name is Adesiwa Sawage, and we have been talking with Dr. Tonika Akunyuli, who is the Clinical Director at Tony Cleo Medical and Facility Center, and a door person for based in Abuja who has come to Edo, to make it all easy for us. So, thank you very much for being part of us.
Thank you so much.
All right,
I appreciate
guys.
it.
We'll see you again on Monday. Bye.